think a breast health center is important for this community and the patients in this community because the focus of a breast health center is really to provide comprehensive care for patients who are undergoing screening for breast cancer.
I'm Dr. Cynthia Lorino. My specialty is I'm a diagnostic radiologist with breast imaging specialty, and I will be practicing at the Breast Health Center here at the new facility on the corner of Auburn campus, which is affiliated with East Alabama Medical Center.
My name is Ingram Millett, and I will be the breast imaging navigator.
I've always been interested in medicine. It's just what I've wanted to do since I was a little girl, and I just found breast imaging and radiology particularly interesting.
When I graduated from Auburn University in 2015, I knew I wanted to go into the medical field, but I didn't really know exactly what I wanted to do. I kind of felt led to go to sonography school, so I graduated from Vanderbilt's Diagnostic Medical Sonography program in 2017. And ever since then, I've kind of been pursuing strictly breast sonography.
The Breast Health Center is going to be a comprehensive breast center. We will be able to provide all methods of breast imaging, and we're really excited to be able to offer something new here for the community. We're going to be giving same-day results for a lot of our patients that choose to receive the results while they're here, and that way if they need additional studies, we can go ahead and do as much of that as we are able to. We want to be able to make it as easy as possible for the patients so that they can get the things they need as quickly as possible. And we'll also have a track for women who don't want same-day results, that they can just come in and get their screening mammogram and then leave if their schedules don't permit them to stay longer.
I know that opening this breast center, we are able to offer new services, and strictly pertaining to my role, one of those services will be if the patient is diagnosed with breast cancer, I'll be able to help navigate them through after they're diagnosed. So if a patient comes in and they get diagnosed, basically they won't have to try to think about what to do next. I'll be calling them pretty much immediately and getting them set up with their next appointments. That way that they are treated in a timely manner and can get taken care of right away.
I think it is important. It was important to me that a woman or a patient have a one place to go where we can have, you can have same-day results, you can have seamless care delivery, that you can be handed off from one caregiver to the next, and that you as a patient are not having to navigate your way through the health system, but you have someone there centrally located helping you navigate to the next steps. Hearing the diagnosis of breast cancer is scary. It shakes your foundation. You're left with questions. What are the next steps? What's going to happen next to me? What's going to happen? Where do I go next? Do I go to an oncologist? Do I go to a surgeon? Do I need to go some other community? Do I need to go away for care? And the whole purpose of this is to provide a seamless, coordinated care delivery system that moves the patient seamlessly from diagnosis through treatment and then on to recovery.
The opportunity that exists here, this area is in need of a comprehensive breast center because there really isn't one here. And it was the vision of Ms. Laura Grell and the board members at East Alabama that have facilitated this and made it all possible. I'm most excited to bring something new to this area that is needed for the women. We want to be here for the women. We want to make things as easy as possible for them, as well as the referring physicians. They can come one place, get their mammogram, get the ultrasound, get their biopsy if they need it, get breast MR if they need it. And then we're going to provide a whole new level of care once a diagnosis is made so that we can make the journey for that patient as easy as possible.
I'm most looking forward to serving the community. I grew up here. I've lived here my entire life. So to be able to give back to the community that I was raised in means a lot to me. I hope that every patient that walks through our door they're greeted with compassionate care and know that if they do get a scary diagnosis, that we're on their team and we're here to fight with them, and that they don't ever feel like they leave here alone.
This community is just an incredible community. It's growing leaps and bounds, and it's just exciting to be a part of all of this. I expect this research park to be something incredible in the next 5 years, and we just look forward to serving the people of this community.
I've talked to many people that hear about what our plans are. They're very excited to have dedicated breast mammographers, breast navigators, centralized in one location where a woman can come into the center, have their results, have their same-day results, have their privacy and their dignity respected. People are very excited. These programs are available in other communities, and I think it's time that we have that same level of care here in this community.
We're really excited to open, and we're excited to see patients, and we're excited to get out in the community and meet everybody, and we're ready to go.